grateful to be here. I go out and do this lecture at a lot of different fitness facilities all across the area because this is a topic that's really important to me, and I find it's also really important to women that are exercising and want to keep themselves as strong and healthy as possible. So just a little bit about myself. My name is Krista Wilson. I'm actually from the area. I grew up and went to Garden Valley, born and raised here. Left and went to PT school and moved back to the area. I now have a husband, 3 boys, 10, 8, and 6. And I just love being in my hometown and my community because I connect with so many people that I've known my entire life. I started my own practice in 2011 as a physical therapist after working at a variety of different PT places across the area. And my business partner and I started because we wanted to offer a different type of PT that specialized in a one-on-one setting. So if anybody's ever been to PT, in most traditional settings, you go in and there's like a couple of different patients at one time. So at our place, we do 1 patient, 1 therapist. That lent itself nicely to starting a pelvic floor practice because you can imagine you can't have 2 vaginas in the same room at the same time. So when we were looking at different programs to expand, pelvic health was a really natural blend for us because we were already working in a very intimate environment anyway. Personally, the reason I got involved with this is having had 3 kids, I kind of saw what childbirth and carrying a child did to my body, and then I saw how it affected my ability to exercise. And then, should we start yelling vagina really loud?
Yeah, I know what a vagina is.
So we started, I started to see how it would affect my ability to exercise. And then I would talk with some of my girlfriends who were like, yeah, that happens to me too. And I'm exercising and I'm peeing my pants when I'm exercising, or I'm out with friends and I laugh and I'm like, is this normal? Is this not normal? So I started to get really interested in understanding what the role of the pelvic floor was for women, whether they had kids or not, and how that would change throughout the aging time frame. So I went to a bunch of different courses and we started a pelvic health practice at our PT practice. So today, essentially what I'm going to talk about is what the pelvic floor is, because I think there's a lot of misconception as to what the heck that even means. And then some tips for you guys in terms of things you can think about as you're working out in this awesome workout environment. You guys are fortunate where you have incredible coaches that have such a keen eye for technique, and they'll be able to help recognize some of the things we'll talk about today and then offer some suggestion for how to improve your technique and support your pelvic floor as you're exercising. The number one thing that I hear is that people are peeing their pants when they exercise. We're not going to do a show of hands, but certainly I appreciate how common that is in exercising with daily tasks, and that really comes down to the role of the pelvic floor. So I brought my vagina pelvis with me today, and for those of you that may not be familiar with what a skeleton looks like, this is the wing bones of your pelvis. This is your spine coming up the back. You are looking at a pelvis just like it's sitting in my body right now. Okay, so you're looking into the belly button towards the back. If I turn the pelvis this way, you see all the red is muscle, okay, and that is your pelvic floor. The pelvic floor forms a hammock that connects the bony structures of the bottom of the pelvis and spine, and it essentially acts like a sling for 2 purposes. One is it holds all your organs in from falling out through your orifices. Okay, so it acts as like a little foundation to hold all of your uterus, your bladder, your intestines into your body. And then the other role is it controls all of the openings that leave your body. So your vagina, your ureter, and your anus. So the pelvic floor helps to create that stability through the bottom. When I talk in fitness facilities, I like to take this explanation one step further, because you guys are very familiar with the phrase core strength. Okay, we kind of throw that around a lot when we're working out, like tighten your core, or the core is really important. So I want to just take a minute to explain my version as a physical therapist of what the core really is, because I think it goes a little further than what a traditional understanding is of the core. So when most people think of the core, what muscles do they think of? Yeah, your stomach, your abdominals, right? So that is one part of 3 pieces of the core. Okay, so the abdominal muscles, there's 4 layers. There's the really sexy 6-pack muscle that runs top to bottom, that all the models have. That's the rectus abdominis. That's the most superficial muscle. Then we have 2 layers of obliques that are on the side. They're responsible for twisting. And then the deepest layer, the fourth layer, is called the transverse abdominis. And what it does is it wraps from one side of your spine, pelvis to rib cage, all the way around to the other side of your spine. And it essentially is like a girdle. It creates a waist. And its job is to cylindrically support the entire trunk. And in doing so, it helps to create tension on the spine to keep your spine healthy and keep space between all of the layers of the spinal segments. So that is the sides of your core. We talked about the bottom of the core being the pelvic floor. Anybody know what the top of the core is?
Diaphragm?
Yes, very good, the diaphragm. Okay, so when we put the diaphragm on top, we now have a completely closed cylinder on the body. Pelvic floor on the bottom, diaphragm on the top, and the abdominals create the circumferential sides. The interesting thing about the diaphragm is the diaphragm and the pelvic floor work opposite. When you inhale and the diaphragm descends, the pelvic floor relaxes. When you exhale and the diaphragm contracts, the pelvic floor raises. Okay, or I should reverse that. When the diaphragm contracts and falls, the pelvic floor relaxes. And when the pelvic floor contracts and the diaphragm relaxes. Okay, so they oscillate up and down, but the overall volume of that cylinder remains the same. So when we talk about core strength in a fitness environment, I think all four layers need to be working together. So that's why we hear a lot, make sure you're breathing when you're exercising, don't hold your breath when you're exercising, because we need that diaphragm to move. We talk about tighten your core, create core stability, but we don't ever say create tension in your pelvic floor or lift your pelvic floor, and that's what we're gonna talk about today. Because that's the one piece that I think we miss when we exercise, because we forget about the bottom. So essentially it's like a can without a bottom on it, and we're letting things fall out, and what's falling out? Pee. So we're losing those things through our pelvic floor. Let me stop there for a second. Does anybody have any questions about the anatomy of the pelvic floor? Okay, good. The other thing that I do like to show before we move on to kind of the pelvic floor exercises is, I said my pelvis comes with a removable vagina, but on the bottom here you can see the musculature of what is surrounding all of the openings of the body. I think that's important to point out, especially if you have had a child, because you can imagine as a tiny, sweet little baby squeezes its way out of this tiny little hole, you can imagine what's happening to those, you can imagine what's happening to those muscles as they become very, very overstretched and or tear or are cut, depending on your OBGYN's practices. So the other piece of pelvic health physical therapy is helping to address pain syndromes that can come as a result of dysfunction, either superficially at the entrance and exit of the vagina, or pain that results within the deep pelvic floor. So if you are experiencing things like pain with sex, pain with putting in a tampon, or pain with passing any kind of bowel movements, that could be related to some type of a muscle dysfunction in your pelvic floor. So we aren't going to talk much about pelvic pain today, and certainly I can stick around at the end if anyone has individual questions, but I do like to highlight that because sometimes people are like, oh, I didn't know that it wasn't supposed to be painful putting in a tampon. I thought that was just part of normal life. So those are all issues that can be remedied with pelvic health physical therapy. So does anybody know the exercise that helps to strengthen a pelvic floor? Yeah, Kegels. Yep, so how do you do a Kegel? Anybody know? Start squeezing it, squeeze it tight. Yeah. Any other thoughts of what people have heard? And then the other question is, how do you know if you're doing it right? You don't. Yeah, exactly. You don't. So I like when I do these talks to talk through how I describe how to do a Kegel to my patients. Because 90% of people, if not more, do their Kegels incorrectly. Okay, when you do a Kegel muscle contraction, you should not have any muscle contraction in any other part of your body except one spot, and we'll talk about that in a second. But you shouldn't squeeze your butt, you shouldn't squeeze your legs together, you shouldn't feel your thighs. I had to laugh when I came in, and today's workout was like, butt, abs, and inner thigh. And I was like, it's the pelvic floor workout, especially for my dog. It's perfect. All of those muscles help contribute to the strength of the pelvic floor, but when we're actually individually contracting a Kegel muscle, there shouldn't be any muscle activation in any of those other muscles. So you shouldn't feel like you're squeezing your butt or tightening your legs together. So the way that I educate my patients on Kegels is through a series of visualizations. So I always tell people the easiest position to do a Kegel is laying down with your knees bent. Okay, so you're kind of in that hook-lying position like this. Okay, this allows your pelvic floor to stay relaxed. It doesn't have to work against gravity. Because you can imagine, as soon as I come up against gravity, what's sitting on my pelvic floor that I'm strength training against? The weight of my organs, right? So when I lay down, it makes it much easier for my pelvic floor to contract because it's like doing it without any weight on top of it. So I tell people, lay down and bend your knees, and what you're gonna imagine is that there is a flower with 1,000 petals blooming out of your vagina. You can imagine when I teach this to a room full of mixed PT students, how much of a hit this lecture is. So men and women. So you're gonna, lay on the ground. Imagine there's a flower with 1,000,000 petals blooming out of your vagina. And what you're gonna do is you're gonna pull all of those petals into your vagina. Okay, so you're gonna feel like you're pulling in from the outside into your pelvic floor or into your pelvis. Okay? And again, you shouldn't feel your butt squeeze, you shouldn't feel your legs squeezed together. It should just feel like you're pulling in. The second stage of that is to imagine that your vagina is 2 elevator doors and you're gonna close them. So you're gonna pull all the petals in, close the doors so that the petals can't get back out. Okay, what that does, that visualization, is it teaches you how to activate the deep muscles of your pelvis to pull in and contract the bottom of that sling or hammock. And then when I close the elevator doors, I'm actually creating tension in the muscles right around the vagina to cinch off the ureter and the vagina. Okay, so I'm getting both the deep and the superficial muscles, which is why I like to show it on the pelvis so you can see how they're 2 different spots. So as you go ahead and pull in like that, you're gonna try to hold, or you can do a different type of exercise where you do it repeatedly quickly, okay? Which one do you think is the one you need when you sneeze? The hold one or the repeated quick one? The one that has to happen very instantly. Repeated quick. So when I go to sneeze, those muscles have to turn on and activate really quickly to create that tension in the pelvic floor so that I don't end up losing any urine. When I do things like planks or squats or even like prolonged jump roping, those are exercises that need endurance. So I need my muscles to be able to contract and hold strongly as I go through my different exercises to create that tension and close my cylinder. So that draw in and hold is gonna help me to build the strength and endurance of those muscles. So how do you know if you're doing it correctly? The true answer is you would have to have someone check, a physical therapist that's trained in assessing your pelvic floor contraction check to make sure that you're doing it correctly. But the way that I like to teach people at home is if you find your hip bones, the very front of your hip points, and you go just inside where it's soft and squishy on most of us, and you put your fingers right there on that soft spot inside the hip bones, if you want to try that now, and the beauty is nobody knows if you're doing it or not, go ahead and do a Kegel. And what you'll feel is that you're going to feel that abdominal muscle turn on. And you can feel that transverse abdominis, that deep pelvic muscle contract. Why is that? Why do we feel it there? Because the pelvic floor and the abdominal muscles and the diaphragm all work together. So as I create tension in my pelvic floor, my transverse abdominis is also contracting. So I'm getting the support around my entire cylinder. So the beauty of that is, as the coaches here at Planks are cueing you to create tension in your abdomen or turn your core on, what's the side effects that you're getting without even knowing? Pelvic floor activation. Okay, so I tell people that are exercising, if you are having problems with either losing your form or losing urine while you're exercising, maybe you're having like a little bit of leakage with jumping or whatever the case is, as you prepare for those activities or as you get more tired with the workouts, really center your attention on creating that sensation of tension in your abdomen. Okay, and then that's gonna help to pull in the pelvic floor. Or contract that pelvic floor by doing your Kegel before doing that exercise that causes issues. I use that cue a lot when I work with runners. So people that like to run a lot often have pelvic floor dysfunction or urinary incontinence with running, because you can imagine if you go running for 20 miles, that's a lot of force that's hitting that little tiny hammock every time you land on your feet, right? The weight of all of your organs banging up and down and up and down. And those muscles over time are just tired. The poor muscles are like, please give me a break, take a bath. So, I like to work with runners and saying like, okay, as you're running, create that tension in your abdomen and allow your diaphragm, your rib cage to move while you're breathing. And that's gonna maintain that healthy give and take of your pelvic floor. And some of that is certainly much more advanced that you would need a skilled professional to help you do if that's something that is a goal of yours. But just keeping that in the back of the mind should start to enhance your performance with your physical activities. What questions do you guys have, if any? It's always funny because it's a very intimate topic and people are like, no, I have no questions. And then afterwards I'll get like 37 emails about like, I do have a million questions. So, and that's what I'm here really to be for you guys today is, for one, I hope that this gave a little bit of insight into the role of the pelvic floor. I am gonna finish by giving you an exercise for your core that you can couple with a Kegel. But before I do that, my real intent is to pass the word to women, because oftentimes when we go to our GYNs or our OBGYNs or our doctors and we bring up something with pelvic floor, in many cases the response is, oh, well, that's just part of being a woman, or that's just part of getting older, losing urine is just part of aging, or that's because you had a baby, or there's an excuse after excuse after excuse, and none of them are valid. There is no reason why pelvic pain or incontinence needs to be part of your daily life. So I do this more in almost an evangelistic way of saying, I don't care if you come to me for pelvic health or if you go to Empowered up in Exton or Women Helping Women down in Wilmington, wherever it goes, but please spread the word to friends if you hear, because my big thing is I want women to know that there's help available and that this isn't an issue that you have to continue to live with your entire life. And certainly there are plenty of resources available. One of the things that I want to make available to you guys, if anybody's interested, is if you leave your name and email. We can add you to your mailer. We do these types of talks all the time. We only send out one email a month, so it's not like a ton of spam. And the other thing is, if you are interested, I have put together like a little brochure on the top 5 pelvic floor exercises. So if you're interested in that, just go on Facebook and direct message us, and then I'll send it to you through a direct message. That way you've got access to that. So our Facebook page is just Action Potential Physical Therapy, and we're right here in Glen Mills. I also have business cards if anybody does want to reach out. But like I said, I always laugh when I come out, because people are like, oh, I hope you get a lot of patients coming out and talking to my group. I don't care if no one comes to me. I really want to just be available as a resource to you guys so that you have assistance if you need it, or I can point you in the right direction of where you can get help if there's any kind of problems. So I have all that stuff up here at the end, but let me just finish by showing a nice exercise. You guys do a great job with hollow body. I love hollow body style exercises because it really does help highlight that transverse abdominis. But one of the ones that I love that pulls together transverse abdominis and Kegel is a modified dead bug. So in this exercise, I start in that position that I was mentioning with the Kegel. I often will have my patients put their finger on the inside of those hip bones like we talked about, and I use the phrase create tension in your abdomen as if I was going to karate chop you in the stomach. I don't want you to suck your belly button in. I don't want you to bear down. I just want you to think about creating tension. Imagine that you're creating that cylindrical tension around your abdomen. And I start that with an inhale and an exhale. Why do you think?
It relaxes the diaphragm.
Because then I get the diaphragm, exactly. So now I'm training my diaphragm to be part of this activity. So I'm gonna inhale, I'm gonna exhale fully. You'll notice as I exhale fully, my ribs are gonna come down. That's gonna allow my abdominals to tighten even better. And then I'm gonna make that tension, and I can feel that by feeling the tension right on the inside of those hip bones. Once I'm in that position, I'm gonna do my Kegel. As I do that Kegel, I'm gonna feel those muscles tighten even more, because now I've got top, bottom, and side contraction around the cylinder, and then I'm gonna bring one leg up and then the other. This may be challenging enough for some people in the room.
As I'm doing this, I can glance down and look at my abdomen. It should be flat. Okay, and I know most people are like, well, my abdomen isn't flat anyway. That's not what I mean. Has anyone ever done it and they see like a little cone on their belly? So sometimes the muscles will pop up and make like a little cone. If you see the cone, that means that deep muscle isn't contracting. So we want to create that tension. As you lift those legs up, that stomach should remain flat. It shouldn't form a little cone. If this is too easy, you can make it harder by alternately lowering one leg and then the other. And if this is too easy, you can add a ball or a medicine ball between your hands and legs and alternate opposite arm and leg away from the ball. So you come back and kind of pinch the ball together in between. This is a nice option for helping to pull in all three sides of that core. And as much as it may seem relatively simplistic here, it actually is a pretty difficult exercise to maintain and do. I had to laugh. Did anybody, with the TRX, when you put your leg in the strap, was anybody able to lift their leg up? How hard was that, right? That's a absolutely ideal pelvic health, pelvic floor exercise. That shows your ability of your pelvic floor to stabilize in your pelvis to allow your hip muscles on the inside and opposite side of the legs to work. So if that was hard for you, that's a good indication that there's a little bit of room for improvement in the pelvic stability. If you were like, oh, I popped right up, which I thought it was incredibly difficult, so I'd be surprised if anyone did. That it shows how weak our pelvic floor gets without us even knowing it. And I thought that was a really cool exercise because again, it really tied in a lot of what we were talking about today.
During exercises like that and lateral movement, sometimes I'm feeling like a little like click
In your groin?
right in my pubis bone. Where would that possibly come from? Is that a ligament kind of loosening thing, or?
Well, so for you in particular, it could be a couple different things. And if everyone is willing, I can just share a little bit about postpartum. So after we have a baby, well, I should say starting with getting pregnant, our hormones change dramatically. And as a result of that, we have increased flexibility in our ligaments. And that's the relaxing. And that's what allows your pelvis to widen and to deliver a baby. Well, after the baby is born, that takes a while to go back to normal, and so we have additional flexibility in the pelvis. And if you're a nursing mother, that lasts for 1 year past nursing cessation. So if you nurse for a year postpartum, you have a whole nother year after you stop nursing before your hormones go back into what they say is like your baseline measurement. And in many cases, many women are then getting pregnant right away again. So their bodies are in these constant state of flux. So postpartum is an area that I'm particularly interested in, having had 3 kids myself and working with a lot of young fitness mothers. There's a lot of reasons of why that could be happening, but one of which could be that your pelvis is very unstable. Because you can imagine, these bones are connected by ligaments and only the muscles in the bottom. Well, we know that the muscles are weak after you squeeze a watermelon out of your vagina, right? They're all overstretched, they've been carrying all that weight. And then not only that, all the ligaments are very loose. So I work with a lot of women that are like 12 weeks postpartum to help give them that pelvic stability back. Because if you don't address it, what happens over time?
It's never
really rebounds. Yeah, and you start to create some bad habits, which then lead towards further problems as we advance in age. So
I don't think anybody ever told you. I mean, my kids are older, but nobody ever talked about any of this after I had kids. I mean, like,
no.
I mean, and I was like ripped, torn, like, and like nobody ever said, "Here, you need to do this stuff to strengthen all that stuff again." Like,
Exactly.
So this is, I mean, I'm way past having kids, but I'm just saying, like, it's good. I think that I mean, for like younger people, because like they do nothing on any of this.
And as a profession, we thought it was a really big win because the American College of Obstetrics and Gynecology recently wrote a position paper stating that all women postpartum need to go see a pelvic PT 1 time at least, which I thought was really incredible because it's like, it doesn't matter if you're going to come for PT, but let me at least just teach you what you need to be aware of down the line so that you're not 20 years postpartum and thinking like, oh, this is just what happened because I ended up having those ratty kids of mine. We want to make sure that we address these issues. I will just say, just to kind of comment on your comment, is I have many patients that come to me, in their 40s and 50s, they had kids 20, 30 years ago, whatever the case was, they might be older. That doesn't mean that issues can't be resolved even that far down the line.
So it's just like any muscle. You train it, you support it, you work through it, and then it does show improvement over time. So I do offer that for the women in the room that are beyond their childbearing years, or their kids are grown, that, you know what, it doesn't necessarily mean that, you know, well, shoot, I'm a goner. So we can definitely make changes. Many of my patients are even in their 70s and 80s that are having incontinence issues because of pelvic floor dysfunction that happened years and years ago. And we do that. Does anybody want me to, I'm happy to explain what a physical therapy appointment looks like for pelvic. Yeah? Okay, so I'll briefly highlight that. I do have to say, like, most people don't know that this is what a physical therapist can do, so I'm going to assure you right off the bat that this is a specialty area in PT that requires additional training. Many of you will probably be like, holy cow, I did not know that was what you were gonna say. So at a physical therapy pelvic floor evaluation, we will do an evaluation of your body structure like a traditional physical therapist. I'll watch you move in a variety of different ways. I'll test your strength, test your hip strength, your core strength, but there is an internal vaginal portion of the examination if you desire. And the reason I say if you desire is it helps to provide the whole picture, but there are ways that we can address the pelvic floor externally if that was something that was a real sticking point or you weren't comfortable with it. But essentially at an examination, we do the full exterior body scan, and then we do an internal examination. What that entails is you would take your pants off, you'd lay on a treatment table, much like the OBGYN, except we don't use stirrups. From the outside, I would push on the muscles that surround your vagina and anus to make sure that there's no pain in the muscles that are surrounding those openings. And then I would take one finger, put it into your vagina, and ask you to do a Kegel. From there, I'm going to determine the strength of those muscles surrounding the opening of your vagina. That's the muscle that's going to help to pinch off in the event that you're losing urine. So I'll do that. After that, I'm going to take my finger and go further into your pelvic floor, and I'm going to touch each of these muscles from the inside to see if you have any pain or spasm in any of those muscles that might be contributing to other pains. And then from there, I would have you do a Kegel in this position as well, so I can assess the strength of the deep pelvic floor. Okay? I do a lot of education on the first day. We talk, you guys kind of got my education series here where I explain the pelvic floor, what it does. I talk through the entire examination. It's not, everyone says, isn't that such an awkward thing to do for work? I find it to be incredibly rewarding and not awkward at all. I mean, it's essentially like this, except your pants are off. So, I mean, it's really very natural, normal, and a comfortable process. And I spend a lot of time educating because I really want people to leave feeling empowered and that they understand what exactly is happening in their pelvic floor. Based on the outcome of that assessment, then we talk about, okay, what are we going to do about this? Does it mean doing internal treatment where maybe I do have to go in and loosen some of those muscles using manual techniques like massage, which sounds funny. It's a vagina massage, yes, but it's just not as enjoyable as you would think when you hear those terms. But maybe that it's like a manual massage to help release some tension in those muscles. If you're having pain right at the opening, it might be a manual massage to free up scar tissue from an episiotomy or things like that to help increase the flexibility of your vaginal opening. Or it might be Kegel training, and we also have a really cool computer system where I can hook you up to sensors and you can watch your pelvic floor contract, and then we can work on strength training with visual feedback.
So the same thing that they hook up to you when you're having contractions?
It's very similar. Yeah, so that one looks at your uterine contractions, this would look at your pelvic floor contractions, but yeah, very similar. They're external sensors. But yeah, you can watch on a screen what your pelvic floor is doing, which is really fascinating because you might be like, oh yeah, I'm contracting. And I'm like, no, you're not. Or, oh, I relaxed. And I'm like, no, you didn't. So you need to learn a lot about what your pelvic floor is doing because it is hard to know from the outside. And again, that's where I would assess, like, are you doing a Kegel correctly? When you do a Kegel, it should circumferentially contract around the entire vagina. Many people only get contraction from the rear portion of their vagina because they're using their glutes to help stabilize that. So they're very over-dominant in the rear part, but that front part of their pelvic floor isn't working at all. So we train on that, and I teach you how to do a proper Kegel that you then can carry on at home or at the grocery store, wherever you prefer, because no one knows you're doing it. Any other questions? Yes?
I'll let my guard down here for a little bit, but I went to a pelvic PT after having a hysterectomy.
Great.
And as awkward as it is, you get over that really quickly because it's amazing the stuff that they you do find the improvement that you get afterwards.
Yeah, and I appreciate you sharing that. Thank you very much.
And very awkward at first.
Well, and I think it depends on the person.
And the person, I mean, the person that I had was amazing, and she really made you very comfortable. And but afterwards, like it's like, wow, look the stuff that you can find, and the massage part. I mean, it's definitely not something you really want to talk about, but
Yeah, no, and
it
I
does
really
make a huge difference.
I appreciate you sharing that. And I think the other fascinating thing about pelvic floor, like if for those of you that had said you'd been to PT before, I had a hip pain for a lot of years after I had my 3 kids that I couldn't get rid of. And I couldn't even reach it, like I couldn't find it. And I'm a PT. I had all my PT friends work on me. My husband's a PT. I had him work on me, couldn't get to it. I had a spasm in my pelvic floor. I went in for the course where I was learning how to do this stuff. A girl went in and she was like, oh my God, released my pelvic floor, my hip pain was gone. But you can't find these muscles from the outside. You can't touch them from the outside. So until I had a pelvic floor.
That's what I went to a PT for, and it was a guy that I had, and he's like, hold on a minute, I want you to see this other girl that does the pelvic stuff, and she did a quick assessment. She's like, I think you actually have something else going on.
Yeah.
Because I thought it was hip pain as well.
Yeah, and oftentimes a lot of patients that come to us are patients that have done traditional PT for back or hip pain or groin pain that didn't get better using traditional PT, and then we go in and we do a pelvic assessment, and we're like, oh, well, that's the reason. And it's not that the other PT wasn't a good PT, it's just you literally can't get to those muscles. So I have a lot of PTs send patients to me that are like, okay, I've tried every X, Y, and Z, but we can't get to where we need to be, and then sure enough, it ends up being pelvic floor.
Can I just say one thing too? So I had the same issue. I had like hip pain that wouldn't go away for a really long time. I did go see Kristen. I just wanted to make the point that I was totally creeped out by it. She's awesome. She walks you through the whole thing. She's amazing. But each time doesn't have to be the internal part. Like they do work on other things besides that as well. So you don't have to feel like this kind of like weirdness every single time you come. Sometimes it can be like one and done and then move on to some other things.
Yes, and I mean, certainly, you can imagine, once that piece of it is addressed, we talked about the core, the diaphragm, the hips, all the other muscles that are responsible for supporting these structures. So, no offense, but I don't want to touch your vagina every time either. Let's get what we need to do done, and then we'll move on and work on the more functional goals that you have, like running or lifting or whatever the case may be. So, certainly, again, thank you for bringing that up. It's not like every single time we're going to be like going in the back room, like we do what we need to do so that we can get to the more important goals of exercise or whatever the case may be.
This was very enlightening because someone who hasn't had kids yet but plans to have kids in the next couple of years, I would have never known to do this or go somewhere or start building that so that way when it does happen, it's not so terrible, or like 20, 30 years down the road, I'm like, oh no. So it's very cool for someone who wants to have kids to know that these things are going to help you afterwards.
Good.
And that there are things out there.
Good, I'm so glad to hear that. And I will say, I had a patient who she works out at a CrossFit box down in Media, and she came in, she's very fit, and she was 4 weeks postpartum. She hadn't even had her follow-up appointment yet. And she came in and we did the evaluation, and she's like, listen, I don't know if I need you or not, but I saw on Facebook that after having a baby, I should see a pelvic PT. And I was like, oh my God, I'm so happy. Like the word is getting out. And that's why I am very passionate about coming out and talking to groups of women, because like as everyone spreads the word, it helps everyone, right? Because we don't want to be this stigma of, well, you're a woman, like to deal with it. And I will say, we'll just put a quick plug in, pelvic floor physical therapy is also for men. So there are a whole host of issues that affect men as well. And men don't have a vagina, but they have other ways to access the pelvic floor. So their pelvic floor occurs in a slightly different manner, which we won't get into today. But if you have a husband or a boyfriend or a friend that's male that's struggling with something that sounds similar to symptoms that we talked about today, there is male pelvic floor as well. So it's not quite as common, but yeah.
I had the pelvic floor surgery 4 years ago. I had a prolapse bladder. Would this benefit me?
Yep. So
and is it okay to lift heavy weights after they told me no more than 35 pounds, but I do deadlifts and squats with heavier weight, and
So
Is that okay? Or?
Yeah, so my answer to that is, and what you're referencing is a prolapse, and a prolapse, for those who don't know, is when either part of your bladder, your rectum, or your uterus falls into your vaginal cavity. Okay, very, very common postpartum. Most women that have delivered a baby typically have a small grade prolapse, which means like a little bit is tucked into their vagina. When that becomes problematic is over time, either of those three organs or the actual internal layer of the vagina itself can start to protrude out of the vagina. So now you have like a pouch or a little piece that you feel like pooches out of your vagina, and you can actually see it, touch it, everything. The reason that happens, you can imagine, we talked about the role of this pelvic floor is to support all those organs and close all those surfaces off. Well, if that pelvic floor is very loose and weak, those organs descend down and start to come out. So pelvic floor physical therapy is very, very helpful for prolapse because it helps to strengthen and pull everything up. And in answer to the second part of the question, which is can I lift, that depends on the strength of your pelvic floor, because you have to be able to stabilize to combat that force of what the weight is going to do to the pelvic floor. So you want to make sure that you're able to stabilize and contract your Kegel and provide the right protection to make sure that you're not getting a bearing down through any of those openings. So prolapse is the third reasons. We covered pelvic pain, urinary incontinence, and then prolapse are the three primary reasons for pelvic floor physical
Could
therapy.
it reverse itself, the surgery? Like once you've had it, could it like fall down again?
Yes,
You have
yes.
to be careful.
They call that mesh failure, so it can. Yeah, so it can actually, pieces of what they use to stabilize it, they essentially go up and they strut it so that it can't come out anymore. Over time, that can break down. So you can imagine, it's like putting in, if you're putting in digging a ditch and you're gonna put like a mesh around the ditch, over time, stuff can start to break down and then things will fall back into the hole. So yes, it can break down over time. And
So this would help.
This would help. Any other questions? And again, yes.
Just if you're at home and you wanted to do a couple of things, like in the morning, like before you get out of bed or something.
Yeah.
So you could do the
Kegels. Yeah.
right? But if you wanted to do something like that at home, but you don't have that, so would it be, could you suspend your foot like on a step and then just
try that way?
The same movement?
Yep, and so what I would do is go send me the message on Facebook or email me. I'll send you the top 5 pelvic floor physical therapy exercises, because there's a version that's much more user-friendly that I would send you, because it will, it'll have the progressions in there that would lead up. This is very, very hard, this version of it. So the one that I'll put in the worksheet is significantly more amenable, because it will allow you to start and progress. But that way I can give you all 5 of them in a row, rather than, because I know some people probably have time constraints and need to head out, but I can, I'll have the core one, there's 2 hip ones, so there's a lot of different great recommendations, but I'll put in my 5 favorite for pelvic floor, and they're all things that require no equipment, so that you can do them. And that's, the way I teach my Kegels after I, go through the technique and the visualization is I just tell people, listen, Kegels to me, I call them red light and grocery store exercises. Like when you're waiting in line at the grocery store, do your Kegels. When you're at a red light, do your Kegels. If you're sitting there waiting for your kid to get off the bus, do your Kegels. Like whenever you're like doing nothing, bang out a couple Kegels, because you want those muscles to be active throughout the day. And no one knows you're doing them. So you could be in church Kegeling away. And you're like, oh, I'm improving my pelvic floor health and my spirit. It's great. So yeah, I like to incorporate Kegels into just like daily tasks, because then you're not like, oh, didn't do my Kegels today. You're just doing them, throughout the day and all the time. All right. Thank you guys so much. I have information up here if anybody's interested. Like I said, business cards. I am here as a resource. Just because you email me doesn't mean you have to come see me as a patient. I don't charge for consultations. If you have questions, please, please reach out, because I want you guys to have access to the information that you need. And like I said, if you don't live in this area, if you live in Springfield and you're like, yeah, this is too far, I can find places for you to go for other care if you don't live in this area. But my card's up here, a little bit of information. Our office is right here in Glen Mills, and we're opening a second location in Kennett next week. So we're kind of in this area. And like I said, if you're interested in hearing more about some of the lectures we're doing, I'll take your name and email.
And then last thing is for the exercises, either email me or private message us on Facebook so I can directly send them back to you. But I'll leave all this. Thank you again to Planks for having me out today. There's way more people that came than I expected, but please help yourself to Turkey Trot t-shirts. We also host the Turkey Trot at Garnet Valley on Thanksgiving morning. These are sweet long sleeve tech tees, so please take them. I'm a humongous fan of this shirt.
They're
it's
super
like our favorite
soft.
One.
Yeah.
Yeah, it's like a sweet shirt. So I brought a bunch.
Nice
And if
color.
you didn't get one, just leave your email, just put a star or something, and I'll send one to you. We'll have to figure out how to get it to you. But yeah, absolutely. So thank you guys very much. Really appreciate it. I'm here for any questions if you have.